Let's talk about panic attacks. This applies to people with Parkinson's disease, but also to people without Parkinson's disease. Panic attacks are much more common than people think, but many people do not want to talk about them because they are afraid that others will see them as mentally weak. Now, technically, I would not use the term mental weakness, but I also do not want to pretend that having panic attacks is something desirable or completely irrelevant. Nobody wants to have this problem. However, you can train your brain to use this sensation in your favor. Anxiety is a good thing to perform well, keep you alert and ready to explode, but you need to have the control in order to work for you and not against you. Panic attacks do represent a vulnerability in the way the brain's threat system responds to certain sensations, thoughts, or situations. The important point is that having this vulnerability does not mean that you are a weak person. Very successful, intelligent, disciplined, and mentally strong people can suffer from panic attacks, and many of them never talk about it. A panic attack is essentially a false alarm from the brain. Your brain interprets a sensation, a thought, or a situation as a threat, even when there is no real danger. Let me give you a simple example. When you are running, your heart rate increases. You breathe faster. You sweat. You may feel hot. Your heart may be pounding very hard, but most of the time, you do not panic. Why? Because your brain knows why it is happening. You are running. Those sensations are expected. Now imagine that you are sitting quietly in a chair and suddenly your heart starts beating faster. Immediately, you may think, why is my heart beating like this? Something is wrong. And that is when the pathological fear can begin. The fear makes your heart beat even faster. You start paying more attention to your breathing. You may feel dizzy, shaky, hot, lightheaded, short of breath, or disconnected from your surroundings. Then your brain says, see, something really is wrong. And now the situation starts to escalate. This is one of the most important things to understand about panic attacks. The initial sensation is often not the biggest problem. The problem is what your brain does with that sensation. The brain interprets the sensation as dangerous. Fear increases. The physical symptoms become stronger. Then those stronger symptoms create even more fear. It becomes a feedback loop. And panic attacks have different levels of intensity. They do not always go from 0 to 100 immediately. Sometimes the process starts slowly. And that is extremely important because there may be a window where you can intervene before your brain pushes you into a full-blown panic attack. This is where brain training becomes important. The goal is not necessarily to make every uncomfortable sensation disappear. That is not realistic. The goal is to teach your brain, this sensation is uncomfortable, but it is not dangerous. Because if your brain stops interpreting every sensation as a threat, the alarm does not need to continue escalating. Panic attacks can happen at almost any age. They can happen in children, young adults, middle-aged people, and older adults. And yes, medications can help. SSRIs such as sertraline or Zoloft and escitalopram or Lexapro can be very helpful in many patients. But medication is not the complete solution, and it does not work for everybody. One of the most important parts of treatment is learning how to change the way your brain responds to these sensations. You have to train the brain, and ideally, you want to understand this process early. Because if the cycle happens over and over again, the brain can learn it. Eventually, you may become afraid of the sensations themselves. You become afraid of your heart beating faster, afraid of feeling dizzy, afraid of feeling short of breath, afraid of being in certain places. And sometimes you become afraid simply because you are afraid that another panic attack may happen. That is how the cycle becomes reinforced. But there is another side to this. If the brain can learn the panic cycle, the brain can also learn a different response. You can train the brain not to escalate. And in the next part of this video, I'm going to show you what you can do when your brain is trying to push you toward a full-blown panic attack. The idea is not to avoid the initial thought of fear. The idea is to normalize it so it does not escalate. See you soon.